record. And Emanuela is also recording.
Yes.
So if you don't want to be on the recording, I mean, you can keep your camera off. We're only going to be using it for our own purposes. So, but welcome everybody. Welcome to this presentation. It's wonderful to see you all joining. I think we're gonna, maybe we wait a minute or two. I know that there's some other people coming. We have looks like about.
And in the meantime, if someone doesn't have his own name or her own name, please, if you can rename your label so we can
know who you are.
Here.
Yeah.
Ciao, Cristiana.
Buonasera, ciao.
Buonasera.
Ciao, ciao.
There are some students from Giuliano School. From Giuliano.
Okay.
Do you remember Giuliano? Yes.
I do.
Okay.
Yes. Yes.
Yeah, and they are here.
Wow. Wow. Hello, Francis from the UK, joining us.
Hi, Francis.
I have
Lisa.
to excuse myself, but is it okay? But I might turn off my video, but because I didn't have lunch, and I'm really hungry. Is that okay?
Yes.
Of course.
Sorry about that.
That's perfectly fine. So, well, welcome everybody. I think we are going to go ahead and get started to do our presentation, because we also want to have time for your questions when we get to the end. We were just thinking we probably should take a minute to introduce ourselves. I think most of you maybe know one or both of us, but I'm Robert Diltz, co-founder of Diltz Strategy Group and a creator of the success factor modeling methodology that we're using to implement in this study of success factors relating to effective healthcare. I'm from California, but I'm currently at my house in Paris right now. I go between the two places. I'm an author, an NLP trainer, a developer, founder of also NLP University. So, and a lot of my work of the many books, more than 28 books, I think now, are the result of modeling. And so one of the things that really, that thanks to Emanuela and her interest, her motivation, and her desire, we decided to take this idea of modeling to effective healthcare, and that's what we'd like to present to you this evening here in Europe, depending upon where you are. So Emanuela, I let you introduce yourself.
Yes, I'm Emanuela. Many of you already knows me, and I am an NLP trainer and a PCC coach, that is a professional certified coach for ICF. Danielle, hello, welcome.
Hello, Danielle.
And I teach communication skills in medicine at university for doctors, for students at School of Medicine. And 3 years ago, I contributed to translate the success story by Robert Diltz, that is next generation entrepreneurs. And after this, I proposed to him, because I had this dream, this vision, to build something useful, something very, very amazing in the healthcare field. And we started to adapt the methodology of success factor modeling to the healthcare field. And now, after 3 years, we have some results and some new tools to present to you also tonight. So we can go ahead
We're
with
we're
our
excited to do
presentation.
this. We've been doing this now for a while, but it's always, to me, it's always exciting. It's I think it's a really exciting study, and it's very inspiring. Many of the people that have been involved. So we're gonna actually go to our slides. I do want to invite you or remind you, if you're, to mute yourself, because I think that helps to not have background noise if you're not speaking there. So I'm going to go to our slides. So what our plan is, by the way, that we will present to you several things. We want to present the results of the study, the assessment that we made as a result of that, and then the training program that we're developing to support bringing what we've learned from the study into the field of healthcare. So this is our introductory slide, and it's significant that you see we have patients are at the center of this solar system and this ecosystem. So so this is a study about the success factors within the healthcare ecosystem. And this is coming from the success factor modeling approach, which we said it's really asking this question: what's the difference that makes a difference? What are these key factors? When something works, what's happening? And this is coming from, there's a series of books we were mentioning. Emanuela translated The Next Generation Entrepreneurs into Italian. That book has also been translated into a lot of other languages, into French, into German, into Spanish, into Chinese, into a number of others. So, in Russian. So that was the approach. And so we said, let's take this into the health field. Now, the basic idea of success factor modeling is that we're always looking at the interrelation between these three things. That our mindset, which is how we think, produces the actions that are what we do. So if we don't have a mindset, we're not going to act. So our mind is what determines what we do, and then that creates the outcomes that we achieve. So that's always what we're looking for, and you'll see that's how we based our modeling project. And Emanuela, I'm going to let you introduce the specific study here.
Yeah, after 2 years of the study that we started in Italy, and after the study started also for the local study in France and in Greece, and why we launched this research to identify the key factors in the healthcare ecosystem for success performance, and organizing into a model to create tools and tools for assessment and tools for applying those factors, and to support individuals and teams and organization in doing this. And how the study has been structured in 3 steps. The first steps has been an online survey where we asked to people their criteria, their key criteria about success in their own role, in their own specific area of the health system. And the second step has been another online survey, but a quantitative survey to explore the different levels of success factors related to specific success examples, case of examples in their own area, in their own role, from their point of view. And the third step, we continued with some in-depth qualitative analysis with a face-to-face interview to go deeper and to understand the details, the specific factors in specific examples.
And who? I mean, we said, let's really reach out to the whole healthcare ecosystem. So not only doctors, nurses, and other health professionals, but patients and their family caregivers, public and private healthcare provider organizations, regional, national, international institutions, universities, research institutes, patient associations, scientific societies, but also entrepreneurs and companies, managers, pharmaceutical companies. So we really want to look at, okay, when health works, it's not just because one person does something right. In order for that person to do something right, it really takes the support of a whole ecosystem. And I think this is one of the really, I think, unique features of this model and of this study, is that it's not just looking at some small part of what makes effective health. It's really looking at the overall patterns. And I think you'll see when we get to the results and to the model, how important that is.
And these are the 4 cases that we analyzed in depth and that we presented in the event, during the event that we held in some months ago. And this is Professor Gasparini, that is also my doctor. And he founded the CIMAD that has been defined the 3rd center in the world for digestive disease. And as you can see also from the image, this is the waiting room for patients, where patient is really in the center of all the processes. So starting from the waiting room, where they can enjoy a bright environment, a beautiful environment with some videos, some video wall, with some learning information, some very useful information about nutrition, about their own specific disease and lifestyle.
In fact, what they were saying is that for them, a patient should never be just waiting. So they don't really think of it as a waiting room. It's a place where people are entertained and learn. So they're always providing something. And this was just really so I think, inspiring about this. They also have designed this where even the rooms where the patient goes to receive treatment, instead of the patient having to go to different places, to different parts of the hospital to get different treatment from different specialists, they go to a room where all the specialists come to them. So it was really a big shift in mindset to say, let's put the patient at the center and organize everything around them. And Dr. Gasparini also says every patient should have at least 3 types of support. The traditional technical support, which is what mostly you get in a traditional hospital, medication, the technical kinds of treatments. But he said you should also have nutritional support. People need to know that what they eat makes a difference. And very importantly, he said they should have some kind of personal support, some type of coaching. And I thought this was really quite, a holistic view. So that was one of them.
And the second case that we analyzed is from institution. And it's about the researcher pyramid. And this man is one of the general director of the Ministry of Health. And he has been working for many years on a new law, in order to recognize the role of the researcher in healthcare field, in medical field. And this really changed the rules of the game in research field.
And another one of the cases was this National Transplant Network. And this was, of course, very interesting because we launched the study before the pandemic started, but obviously the pandemic really brought out the need for healthcare and for more effective healthcare. And so obviously, if you think about it with transplants, when you have a pandemic, it can really make things difficult, but they were committed to not have people, have to wait on a transplant because of the pandemic. And so they really had to be very innovative in what they did.
And the last one is from patients, from an association of patients. This man is the president of IPA-C, that is a national association that works on hepatitis C. And the case is about the new therapies for all patients, the new therapies for hepatitis C. Why? Because when these new therapies arrived, they were really, really very expensive, and the government decided to give just to a part of the patients. It was upon their own, if they had an acute disease, they could receive treatments, otherwise not. And they built very powerful partnership, very powerful agreement with institutions, with pharmaceutical companies, and so on. And they achieve the treatment for all patients with hepatitis C.
And they in 5 years, I think they were able to get treatment for, I think it was something like 2.5 million people. I mean, so they saved that many lives. And you can really see, as Emanuela was sharing too, they were really looking at this partnering with the ecosystem. Now, these were some really inspiring examples. They're also, I think, as you can see, these are very high level. These are very advanced institutions. But we also had many, many others. We actually had with several hundred people participating in this interview from all different levels, also people that were independent health professionals, people that were coaches, trainers. And so we really wanted to get a broad view. And and what we did was to look at different levels of success factors. Some of you might be familiar with the levels model, where we say there's an environmental level, and that's usually where we're trying to achieve the outcome. It's concrete, it's related to a particular time and a particular place. And then we have to do things in order to achieve those outcomes. So we were looking at what outcomes were achieved, what were some of the environmental factors, and then what were the behavioral factors. And then, of course, we were looking at this higher level we were calling mindset, which includes several different types of factors that we were asking about in our research. Things relating to capabilities and skills, but also to the values, beliefs, the priorities, but also things at an identity level, with this idea of what people's sense of their role and their mission. And then also this bigger sense of a shared vision and purpose. And these are the things that make up mindset. And we also found, in addition to one other very important factor, which was passion.
That's what we have.
That's where there was this resonance, this passion.
Yeah, this is the reason because we are here today.
So how did we do? We started, so these are some of the results we have for these first 2 years. And we started here with this question.
How do you define success in the healthcare field? So what are your criteria? And we started with some more than 40 statements, more than 40 scenarios, and we took them from the World Health Organization and the Centers for Medicare and Medicaid Services and the Institute for Healthcare Improvement, and some other scenarios from companies, scenarios, from coaching scenarios, from business scenarios. And the factors that emerged from this on the environment, about outcomes, about success definition, where expertise and the specific scenario was each team member knows roles and tasks.
So again, out of these 40 statements, these were the top 4 or 5 that were most shared. These were what people said were the key outcomes that are necessary. So you need to have each team member knowing their roles. Also, this idea of empowerment, which had to do with a very good relationship between team members. So the team members, whichever part of that health ecosystem we were in, that there was good interrelation and interaction and communication.
And effectiveness together with efficiency, effectiveness with very clear and effective physician-patient communication, and efficiency, that we can't have efficiency without effectiveness, or effectiveness without efficiency. And efficiency was about very efficient and effective health provider organization.
So here you, by the way, you also see the importance of the ecosystem. In order for there to be clear and effective patient-physician communication, there also has to be effective healthcare providing organizations. So the support has to be there. And that relates to this other factor of engagement, that all of the actors are involved. So when these 5 factors are there, these 5 outcomes, these are the goals that are being focused on, then healthcare really works well. And of course, then our next question was, what actions contribute to creating those outcomes? So as we asked people, think of what actions were the ones that were most important to create the successful case that they were focusing on.
And the main results, the most part of the answers were about to clarify, and specifically about work routine or procedures, and communicate about protocols for communication or addressing key issues. And we have seen during the pandemic how much the communication has been important, sometimes negative communication, and sometimes, fortunately, luckily not.
Right. When we talk about a success factor, it means if it's there, it's producing a good result. If it's distorted or it's not working well, it can produce a really negative result. By the way, just to explain as well, you see that the star, we represented these outcomes as a star. Now the actions, as you see, are part of that star. So expertise is a result primarily of the ability to clarify. Empowerment comes from communication. Then effectiveness, we found that was related to the action of caring, which meant, in this case, strong interrelation between professionals, that they're really caring for each other, caring about what they're doing. And that also allows them to co-create, so that they could, and this was so important, especially during the pandemic when things were so disrupted, that people could not just rely on the old procedures and routines. They had to co-create new prescriptions for responding to particular situations.
And to collaborate, related to the engagement with involvement and collaboration. As you can remember, engagement was about all the actors are involved. And in this case, we have to collaborate as the key action.
So this, we found this was already very powerful. And so then we said, okay, but to do these things really requires a shared mindset. That is, in order to act in these ways, to collaborate, you don't just collaborate. It requires a way of thinking. It requires values. It requires skills. So we started looking at that level and those levels. And so there we were asking these questions about the characteristics of mindset. As we said, skills and capabilities, values and beliefs, which relate to things like the motivation, that sense of identity, which is about mission and role, and then this idea of vision and purpose. So we were saying, what is in your ecosystem, and from your perspective in the ecosystem, which of these things were most important? And so there's a lot there. We're going to kind of show you, we kind of clustered these together in I think some very interesting categories that you'll see.
The first one is connection, and as you can see, with on the skills level, we have communication skills, about belief we are responsible to our success, about identity, connectors the identity mindset as connectors, and on purpose level, expanding individual and collective excellence.
And so on another level was about compassion. This was the compassion mindset, which was founded in emotional intelligence, the belief that patients come first, the sense of identity of enablers, and then obviously the goal of increasing possibilities for treatment, so enabling even more possibilities for treatment. Oops.
And the other one is contribution with interpersonal skills and enhancing patients' abilities to face illness with courage and hope. And we know that how hope can help, can support a patient in his own path, and is also like a placebo effect is defined. And on beliefs level, it's important for us to innovate, and the co-creators mindset.
And then we had this other area of mindset of catalysis, where catalyzers, which is about making things happen, problem solving skills, this idea that we're capable to adapt, and the sort of vision there and the purpose is effectively overcoming challenges and difficulties.
And the competence, and about competence, about self-awareness, about the belief of skills and updates are essential, and the builder's mindset, and the purpose of raising awareness.
So these were all of the aspects of mindset. I know there's a lot of them, but you can see they cluster together, and I think they support each other. So then we put these all together into our model, where we would say, and here we see that, like, for example, the connector mindset, this idea of connection, that's supporting the actions of clarifying and communicating. So this connector mindset, that we're responsible for our success, communication skills were necessary for clarifying and communicating, and then producing those results of empowerment and expertise.
And the enabler mindset that supports action to care and communicate, that are related to empowerment and effectiveness.
And then similarly, this idea of the co-creator mindset, desire to make contribution, to enhance the patient's ability to face illness with courage and hope. That was both caring and co-creating, and that produced these results of effectiveness and efficiency.
And the catalyzer mindset that supports the key actions about collaborate and co-create in order to support patients to effectively overcoming challenges and difficulties. And we know that every time for a patient, every disease, every path in front of them are really challenges every time and every day.
Then we have the builder mindset. So this is about developing competence and this notion of skills and updates, and really this idea of self-awareness. And that supports these actions of clarifying and collaborating together, and then creating these outcomes of expertise and engagement. And so you can see, what's very interesting was that we found that these mindsets would support particular actions that then create these outcomes. And so we put this in a simplified version, is basically this. We have these different mindsets that support the actions and then produce these results. And what we wanted to do from there is we said, okay, now that we know that, we can now begin to come up with a type of way of assessing. Now, before we go to that though, we sort of built this from our first year's study. And then we expanded, as Emanuela was saying, we expanded into looking at our in France and in Greece. And so we found that there was a lot of very interesting common factors. Of course, there are some things different, and you might expect things to be different, but it was very rewarding to realize that there was actually many common factors, even in different cultural contexts. And so, a first one was this definition of success as being clear and effective doctor-patient communication.
Yes, and about environment, about outcomes, the comparison says that tools or technologies and environment that supports interrelations were the factors in common between the main factors, the main results from Italy, France, and Greece.
And then on a behavior level, that action of involvement and collaboration.
And on capabilities level, the skills in common are emotional intelligence and communication skills among the first results.
Which was so important if you think about it, that combination of emotional intelligence and communication. And I can tell you, somebody like this Dr. Gasparini has so much of that. He says that you need to be able to communicate. He actually said, if you do not, any physician that does not know about the first 4 to 6 years of the life of their patient is not really fully doing their job, because those are such formative times. And so he's really not just thinking of the patient as a symptom, but as a whole human being. And again, on this level of beliefs and values, it's, patients come first, and we are responsible for our success.
And on the identity level, the co-creators mindset and connectors, just because to create together something that they have the vision that they want to create, and connectors between different actors, different reality for building different partnerships.
And of course, that sense of what reality do we want to create, and the most common vision, the most common purpose of through all the study, through all the different people in different countries. And we also did have an international study where we opened it to people from different parts of the world. It was enhancing the patient's ability to face their illness with courage and hope. And to me, I think that is such an important thing, that it all starts, in a way we could say it all starts from there. From that mindset, from that vision and that purpose, let's enhance the patient's ability to face their illness with courage and hope. To do that, we're going to be co-creators and connectors, put the patient first, be responsible for our success, bring emotional intelligence and communication skills, involve each other and collaborate, and then really, get those tools and technologies, work with those. So I think you can really sense it, how clear that is. And so one of the things that we thought then is what we wanted to do is to have an assessment. And so we've created an online assessment. It can also be done by hand, but we have it in a booklet form, but it's also online. And that really helps us to do these very interesting things. This is an example. There's several parts to it, but so here you can see would be an assessment of the present state. So we would send this link out to the different members of a health ecosystem. And then we're asking them to rate their current outcomes. How engaged are all of the actors in your part of the ecosystem? Are many of the key actors not engaged? Are all of the key actors engaged? 1 to 5. And then empowerment. What about, what's happening in terms of good relationship and communication? And then going to effectiveness and expertise, efficiency. So you can see, you rate the present state. And then, by the way, one other thing that you might notice, that this is not really online, but you can see that we've also have this assessment that we have connected to the Google Translate, so that we can actually translate these into different languages immediately. So now the next phase is that you're looking at the desired state. So the green marks the desired state. Now, why, you might say, well, of course, why doesn't everybody want to make green all 5s? And of course, eventually you would want to be all 5s. But what we're usually doing with this assessment is we're having people look at a specific time frame. because we know there's so many right now, there's often so many uncertainties, there's so many challenges. So we might be looking at for the next 3 months or the next 6 months. So we're not going to be able to get everything perfect in that time frame. So we're really looking at, in this time frame, what is possible for you to improve and where do you really need to improve. And once they set that, then we can show them, here's what has to be increased in terms of the actions and the mindset in order to get those outcomes. And so here we have a way of being able to look at where do we need to focus. And in this case, you can see that, you know, the key ones that in this particular example would be the connectors and the enabler mindset has to really be improved in order to increase communication and co-creation. So then from there, and Emanuele, I'll let you take on this one, you know, so we decided, okay, now we're going to create, if you think about these different areas of mindset that are going to produce the actions and the outcomes, we wanted to create a training program that we could bring into the health ecosystem.
And this training is about different kind of outcomes, also for different and for specific improvement areas. So for achieving a higher level of awareness, communicating in a more effective way, knowing, recognizing emotions, for emotional self-motivation and motivating others, and effectively overcoming present and future challenges related to the different areas of improvement.
And so we are starting in January to do an online version of this. We also have a version we want to bring into institutions, but we're going to be starting with this area of connection, because remember, connection is one of the important ones, and that's about achieving communication excellence and using communication to clarify and increase expertise, but also empower others through communication.
And the second module is about compassion in February, and to go deeper about emotional intelligence and using emotional intelligence for empowering communication, and how emotional intelligence helps us to care more effectively.
And then in April, we're going to be doing this module on catalysis, which is about developing expert problem-solving skills and how problem-solving helps to efficient co-creation, but also using it to collaborate effectively in order to increase engagement.
And the fourth in May is about competence, and specifically applying the power of self-awareness. For what? For developing self-awareness in order to clarify where and how to expand your expertise, and how self-awareness helps us to be more engaged and collaborate better with others.
Then in June, we're going to have our final module on this idea of contribution and activating the magic of interpersonal skills, which is about then applying interpersonal skills to increase efficiency by co-creating with others, and also how interpersonal skills help us to be, to more authentically and effectively give care to others. So, and we've designed these trainings so that they're all half-day, they're 2 half-day online modules. They take place from 2:30 to 6:30 Central European time. They're for all members of the healthcare ecosystem, but also health professionals, managers, coaches, trainers, caregivers. So whoever's working in these areas of healthcare. And we've really designed them to be very practical, pragmatically focused to this area of healthcare from the things that we learned from, especially from our face-to-face interviews about the things that were really important. So if you're interested, you can find out more about the sfmforhealthcare.com or diltstrategygroup.com. You can also use the QR code that Emanuele has made there. So we want to...
Very nice QR code. Please appreciate it. And this is our metaphor. This is the metaphor from where we start roots, and with real candles. And because that's the vision, that's the purpose at the beginning. Thousands of candles can be lighted from a single candle, and the life of the candle will not be shortened. Happiness never decreases by being shared. And this is a metaphor, this is a quote that we really love, and that enlightened us to start this project, this research.
So we want to say thank you, and we want to now have some time for any questions that you might have, either about the research, about the study, or about the assessment or the program. I can say that this was a research that our biggest vision for doing this, our vision and our mission was, we really, both Emanuela and I have a strong background in the health area. We also have, our own personal examples of where healthcare can save lives. And so for us, the bringing of the success factor modeling there was something that's really just a vision. Our goal is along these lines of really wanting to create a world to which people want to belong, and to which they can belong in a healthy way. So we're just interested if you have any, it could be any comments, any clarifications about either about the study or how we did it, or about the assessment, or anything like that.
Here with you. For you and with you.
And you can put it in the chat if you want, or you can either raise your hand physically, or you can use the little hand icon if you want. So any clarification, any question, anything you'd like to know more about?
Raise your hand.
Thank you for all the nice comments in the chat, by the way. It's very touching.
Thank you very much. It's fantastic. And thank you very much. New message. You can also talk. You can open your microphone and you can talk.
Yes.
Thank you, Robert and Emanuela, for sharing this beautiful work.
I see Danielle. Danielle, go ahead and.
Yes. Yeah. Thank you. Thank you very much for this very accurate and relevant presentation, Robert and Emanuela. My question is how this model can be applied not only to healthcare environment, but also to social environment.
Yes.
I'm thinking about people working, social workers, and those who are taking care of others who are not particularly in a good social condition. And the last thing I want to show to Emanuela, during my years ago, I was in your group and of each of us a candle,
yeah,
and I still have it. And I want just to share. I still have it. So this is what I wanted also to add.
Thank you.
This is my question.
Thank you, Danielle.
I think we probably both have an answer. Actually, it's interesting that you asked that, Danielle. We did recently we did a presentation, and somebody was saying, wow, this seems to be not effective only for just healthcare, but for any organizations. You can apply many of those same, things. But I think your question about, social workers and other providers of that way, that we do consider them to be part of the healthcare ecosystem. And I think they should be. I think what's kind of crazy in a way is that they're not considered part of it. And that's one of the things that really touched me about Dr. Gasparini, because he said, patients should have this kind of social support. Their social environment should also be considered part of their, their basic health. And so, for us, when we really think about that as being in that healthcare ecosystem, it includes the social workers, it includes the social life of the patient as well. And that's why we wanted to reach out to that entire ecosystem. So that we would say, Danielle, I think the assessment would still be the same. How engaged if you're a social worker, how engaged are you and the others? How involved are you? Are you involved in the co-creation? All of those different aspects. So that would be my answer. To me, that's why we did the study, that those that you just named should be part of that.
Yes, Laurent.
And Emanuela, anything you would want to add?
Yes, I agree. I totally agree. And also thanks, Danielle, for your that's for us. And real in the social for the social workers is the same, because often social workers work with patients, and in any case they work with people in specific kind of needs. Sometimes not always patients, not always some kind of disease, but some kind of technology. There was also Esther. Esther, are you there? Are you still?
Esther, are you? Esther, are you still there?
My problem is I don't speak good, but I love the work. I think it's really necessary and it's so
Motivating, inspiring.
Motivating, yes, it's very necessary. It's the first step for health, for the people to get inside the health, no? When are in this ecosystem, all goes, no? I will love to do, when you do in French or in Spanish, the formation. Really love. Thank you very much.
Thank you,
Okay.
Esther. I will say we are planning to do one in French. In fact, tomorrow evening we're going to be doing another presentation specifically for the French-speaking community, and we will be doing a conference about this, so it's like a 2-day conference that goes into this in more depth in Paris, and that's going to be in February.
February. Yes.
So we'll be starting the training after that. So
In February.
We'll be letting you know.
Yes, of course. I thank you very much. And will be also 5 modules.
The 5 modules. Yeah.
Yes.
Models. Fantastic.
Great. Thank you.
Tomorrow,
tomorrow
we can have information for tomorrow.
It's the same time tomorrow. I guess, Emanuela, do we have
yes, I can give you the link in the chat. Yeah. I can.
Yeah.
Wow, nice. Thank you very much. Fantastic. I will do.
In the meantime, Robert, you can
all
talk.
the things. Sorry.
So
in the meantime, Robert, you can go ahead, and I'm looking for the link for Esther.
Okay, great. So I see that Olga has a question.
Yeah, hello, Robert.
Hello.
I'm from Greece. I'm working together with Alexandra. I have a question. Is it possible, before going into specific training, just to use the assessment tool on a specific, let's say, speciality of healthcare practitioners, and then in a way produce specific results for them, and then
Yes, Olga, thank you for bringing that up. Yeah, we designed the training as a way to support this, but actually the way we were using the assessment at first is we were having people from their specific area in the healthcare field they would do the assessment, and then we would actually have them figure out what will be their action plan.
Okay.
And what will be their commitments. And what we actually were doing, and we do this a lot in the conferences, is having people from different parts of the local healthcare, ecosystem actually get to meet each other and even start to support one another.
Okay.
So you can absolutely use that assessment without the training itself. It shows you where you need to improve. And
exactly. As a step one before entering into specific training. Okay.
Exactly.
Thank you.
Thank you. Great question.
Esther, I wrote in the chat the link for the registration for the French webinar. Okay, and the previous one, the previous link is for the enrollment to the mindset training program. The previous one.
Okay, I see.
Thank you very much.
Thank you very
much.
You're welcome.
I see Virgil has hand up. So Virgil.
Hello, Robert. Hello, Emanuela.
Hi, nice to see you again, Virgil.
Hi there. As you know, we just did the workshop in Holland. I'm working in Holland. I'm working as a psychosomatic physical therapist. I'm also very happy you shared all this. My question is, well, where do I start?
Join us.
Well, I'm here.
Great. Thank you. There's several different places or ways to go. One is, there are some other people from the Netherlands who are also in our previous webinars. And one of the things we were thinking of is you can actually do a study, so we have the study that can be done. There's a link, and people can take that study. And for example, it could be very interesting to see how people in the Netherlands would respond to that. Certainly, a good next step is, there are the conferences, and then there's the training too. And the way the training would be for somebody let's say like for you, Virgil, be somebody who is engaged as a psychosomatic practitioner, but also somebody who works coaching and training others. So we really designed it so that it's for the people who are needing to improve as a healthcare provider or practitioner, but also those, kind of like in Danielle's question, those who are supporting them and supporting patients as well. So I would say the two next steps, one would be conference, which there is again one that will be coming up in Paris, and then also the training. And we'd be happy to support you and put you in touch with some other people in the Netherlands that are interested in doing a local study.
Yes.
Okay, thank you very much. I would very much like to get in contact with people in Holland. Yes.
We see this, by the way, one of our views of this is that we really intend it as like a movement. I think so many of us, we know that healthcare really needs to go to another level, and it can. And I think there's a sort of an opening. We see this with some of these, with some of these amazing institutions that are really, innovating in some very deep ways. So I think this is a time to catch this wave and move it forward. So.
And Virgil, I put the email address on the chat, so you can write. Also, we can have a call to explain how the project can be started in each country if you want. Okay.
Okay. Thank you very much.
If you think about that metaphor of lighting the candles.
Yeah.
We would love, Virgil, to light. We want to light your candles so that you can light other candles.
We have another candle here, but she wasn't in Santa Cruz, but she lighted many candles in Greece. Alex, are you still there?
Alexandra is definitely one of our.
I don't know.
I'm here, always, of course.
She is another candle.
There's Alex.
I'm here. I'm here. Yes.
He's from Athens.
Yes, good to see you. So,
Yes. Yes, it was very interesting, this whole study. And I was so glad, Emanuela and Robert, to see them participate at the psychosomatic medical congress. It was a unique congress. It happens every year, and they were really open to this model, to hear this model.
yes, and thank you, Alex, for helping to arrange that. And like Alex was saying, though, I think this is a time where there is an opening, and I think the pandemic has really sort of awakened this feeling of need for something more, and realizing that, you know, healthcare is not just about only at the technical aspect. There's so much more involved. So thank you, Alex, and thank you for helping to sponsor our Greek study. So, well, I guess we're down to our last couple of minutes. Anyone else have anything either you want to share or ask about?
Okay, so we can say another thing about.
Wait, I think is that yes, Josephine. Here, let me add you here. Go ahead.
Josephine.
Hi, Robert.
Hi.
I just heard a story from Virgil, and I'm from Holland too. So I'd like to connect if we can, because I had a sort of the same question. Where do you start this big animal? Because it's very big. It's like when the desired state and the present state, it's like how long, you know, this is far away. Yeah? It's a big distance. So I'm very interested in the first step or something. Yeah.
You know, one of the things that we've been doing, and it's you can see with some of these when we were doing the face-to-face interviews, I think one of the important things is to find these role models that are opinion leaders as well. So this hospital, this CHIMAD, the you know, gastrointestinal hospital, that's, you know, ranked number 3 in the world for, as Manuela is saying, digestive disease, but they're also in the top, they're ranked in like the top 50 of all hospitals in the world. So we're finding these opinion leaders, these role models, these examples that give both credibility, but also show people, you know, show other institutions what is possible, that it can be done. And I think that's one of the things we would be looking for. And so, you know, also we're looking for those in France, we're looking for those in Greece, if those, we'd be looking for those in Holland. I'm sure there are some role models of people who are doing these things. And again, as you were saying, Josine, it seems so big, and in the beginning it can seem so far away, but when you find these role models and you can actually hear what they have been able to do, it's amazing, you know, it's inspiring. And so I think with passion, with support, and with some of these skills, it's possible.
Thank you. That's hope. There is hope. Yeah, thank you.
Thank you for that great question too, and for that. So, well, so everybody, want to say thank you for joining us this evening, or whatever time it is, and what time zone you might be on. But just thank you for sharing this. Like we really do see that what we want to do is light these candles, and hopefully maybe a little bit of our flame and our passion can touch you. And we will be, obviously we'll be letting you know more about other things that we're doing. We are going to be doing other presentations, and as we said, these conferences, and then the training. So we do have a vision for what will be happening in the coming year.
Yeah. Thank you really for coming and for sharing, and for allowing us to go ahead with these candles.
I want to say myself a big thank you to Emanuela for her vision, her passion, and commitment.
Bye-bye.
Bye, everybody.
Bye.
And if you need any
Bye.
clarification, write to us.
Bye.
Bye.
Bye. Thank you.
Ciao. Bye.
Bye bye.
Bye bye. Thank
Bye-bye.
you.
Bye.
Bye-bye.